Does digoxin prevent worsening of heart failure among patients with rheumatic heart disease? Can parental support mitigate burnout during residency or fellowship? And for patients with osteogenesis imperfecta, does improved bone density reduce fracture risk? This and much more on today's JAMA Editor's Summary. Hello, and welcome to our listeners around the world. Today is Friday, May 15th, 2026. I'm Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. Today, I'm joined by JAMA Deputy Editor, Dr. Preeti Malani. Hello, Preeti. There are 2 new research studies on digoxin and heart failure.
Hi, Kirsten. JAMA listeners know that rheumatic heart disease remains a major driver of heart failure globally, especially among young adults in low and middle income countries. Yet the efficacy and safety of digoxin in this population is not known. Dr. Karthikeyan and colleagues enrolled nearly 1,800 participants from 12 tertiary care hospitals in India in the Dig-RHD trial, a multi-center double-blind randomized trial. Participants had a mean age of 46, and most were women. Participants were randomly assigned either to daily digoxin or to placebo, plus usual care, and followed for a median of just over 2 years. The primary composite outcome, death or new or worsening heart failure, occurred in roughly 31% of the digoxin group and about 36% of the placebo group. New onset or worsening heart failure occurred in about 26% of patients assigned to digoxin and 29% of those receiving placebo. Severe drug toxicity was rare. The investigators concluded that digoxin, an inexpensive, widely available medication, may safely reduce worsening heart failure among young adults with symptomatic rheumatic heart disease.
While continuing with the theme of Digitalis therapy, JAMA published a meta-analysis by Dr. Damon and colleagues on the effects of Digitalis glycosides in patients with heart failure and reduced or mildly reduced ejection fraction. The investigators included data from over 9,000 participants in 3 large contemporary placebo-controlled randomized clinical trials that each included more than 1,000 patients. These trials were designed to assess the composite of time to cardiovascular death or first worsening heart failure event. Digitalis glycosides, including digoxin and digitoxin, were associated with a lower risk of the combined outcome of cardiovascular death or worsening heart failure events compared with placebo, mainly by lowering the risk of heart failure worsening. This benefit was consistent regardless of the background of heart failure therapy or whether digoxin or digitoxin was used.
Well, it sounds like those results suggest Digitalis glycosides could be helpful as an add-on option in selected patients with heart failure. Let's move next to improved risk prediction in hypertrophic cardiomyopathy by Dr. Kramer and colleagues. The U.S. NHLBI Hypertrophic Cardiomyopathy Registry prospectively followed about 2,700 patients with hypertrophic cardiomyopathy for nearly 7 years. The investigators combined clinical, genetic, imaging, and biomarker data, including questionnaires, blood sampling, and cardiac MRI, to model which factors best predicted major events. The predefined composite adjudicated primary endpoint was the time to first event for hypertrophic cardiomyopathy-related deaths, non-fatal sustained ventricular arrhythmias requiring cardioversion or defibrillation, and left ventricular assist device implantation or heart transplant. The investigators reported that left ventricular structure and function and N-terminal pro-B type natriuretic peptide levels, or NT-proBNP, provided the strongest prediction for sudden cardiac death outcomes. These results may support incorporating advanced MRI and NT-proBNP into routine assessment of patients with hypertrophic cardiomyopathy.
Burnout among physician trainees is a known challenge, especially during pregnancy and early parenthood. Dr. Rubio Chavez and colleagues conducted a randomized trial to assess whether a practical, multi-part parental support package could reduce distress and burnout among pregnant and postpartum residents and fellows. Pregnant trainees were assigned either to usual care or to a package that included a smart bassinet, wearable breast pump, virtual perinatal support, and formal faculty mentorship, all provided from early pregnancy through 24 weeks postpartum. The investigators reported that burnout scores climbed during the postpartum period for both groups. However, the increase was significantly smaller for those assigned to the parental support package. The authors conclude that structured organizational support could substantially mitigate postpartum burnout among physicians in training.
For adults with osteogenesis imperfecta, bone fractures are a lifelong source of disability and pain. The TOPAZ trial, a large multi-center open-label randomized study, studied sequential therapy with the parathyroid analog Teriparatide daily for 2 years, followed by Zoledronic acid, compared with standard care in 350 adults. The primary endpoint was the number of participants with imaging-proven incident fractures. Although Teriparatide plus Zoledronic acid resulted in greater increases in lumbar spine and total hip bone density, there was no significant difference in fracture risk between the groups, with nearly 37% in both groups experiencing new fractures over the follow-up period. Adverse events were similar as well. The results underscore that bone density may be just one piece of the puzzle. In osteogenesis imperfecta, inherent bone quality defects may be more critical than bone density per se in terms of fracture risk. Let's turn now to this week's Viewpoints and Perspectives, starting with nutritional guidance.
Well, in their Viewpoint, Dr. Story and colleagues comment on the new 2025 to 2030 U.S. dietary guidelines, focusing on the implications for children. The authors call for more practical, pediatric-focused guidance and for federal action to make healthy food more accessible and affordable. We've also published a timely viewpoint covering the possible dissolution of the Health Resources and Services Administration, or HRSA, and what it could mean for physician J-1 visa waivers. Dr. Barajas Ochoa and Casca warn that restructuring could throw a wrench into legal and administrative processes essential for international medical graduates to serve in medically underserved areas. And a new perspective article from the Center for Medicare and Medicaid Services Innovation Center. Jacob Schiff and Abe Sutton introduce CMS's new approach, outcome-aligned payments, to reward technology-enabled chronic disease care in Medicare. Rather than reimbursing for each activity, this new payment model links payments directly to clinical improvements for patients, such as reductions in blood pressure or improvements in depression score. The authors suggest that models like these could incentivize meaningful innovation and provide an alternative to traditional fee-for-service, helping move the system closer to rewarding value.
This week's JAMA Clinical Review focuses on amyotrophic lateral sclerosis, or ALS. Dr. Ravitz and colleagues provide a timely and practical summary. ALS remains a progressive and ultimately fatal neurodegenerative disease involving both upper and lower motor neurons and is marked by painless focal muscle weakness that spreads. Tune into this week's JAMA Clinical Reviews podcast featuring author Dr. Ravitz and JAMA Deputy Editor Dr. Mary McDermott as they discuss current evidence regarding diagnosis and treatment of ALS. Here's more from Dr. Ravitz and Dr. McDermott.
Yes. Will your review discusses sporadic and familial ALS? Can you talk a little bit about that and how that relates to genetics and why those two forms are important to distinguish?
Sure. The genetics, we realize now, is about 15% of the ALS population has usually an autosomal dominant pattern of inheritance, and then about 85% is sporadic. The familial has led the research because once you have the mystery with ALS is what's causing it and what are the molecular mechanisms. So with the genes, we now have handles to bring that into models, and it's opened up the research. It also has implications for family management because if a member's been identified with a genetic form, then it has implications for all the first-degree relatives.
In this week's JAMA Insights, Dr. Wilson and colleagues address chikungunya, a mosquito-borne virus that has caused outbreaks in more than 100 countries, now expanding in both range and frequency due to warmer temperatures and increased travel. The authors review symptoms, important travel precautions, and vaccine options. There's also a helpful patient page that has basic information on chikungunya.
And as always, there's a lot happening in health news. The JAMA Medical News team has a summary podcast that publishes every Friday and gives our listeners insight into the latest medical news. You can subscribe at jamamedicalnews.com or click on the link in this episode's show notes.
That's a wrap for this week's JAMA Editor's Summary. Thanks, Preeti, and thank you to our listeners for tuning in to hear what's new at JAMA. These highlights were brought to you by Dr. Preeti Malani and me, Dr. Kirsten Bibbins-Domingo. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in this episode's show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.